Hey there, welcome to another session of the Laser Guru here. This is Dr. Jay Burns. Again, I'm a little bit hesitant to be prideful and call myself the Laser Guru, but we're trying to just get something that you can remember. I have 35 years of experience and probably as much experience as any plastic surgeon in the world in the last 35 years, but still there's a lot of great plastic surgeons out there. But here's what we're doing today. We're going to head and today what we're going to do is we're going to pick up where we left off. And I think last time we talked a lot about BBL and the huge advances that's been, and that's really for anyone walking in our office. If you have dark skin, maybe not, because it does see color. We've got other options for that. But in terms of just texture, pore size, improving the overall appearance and color of your skin, decreasing the reds and the browns and making it more homogeneous. And that applies to almost anybody, young or old. It's a fantastic device. But what do you do when you have wrinkles, those deep etched wrinkle lines, almost always in women, because men have their own issues, heavy brows like me, bald head. But women have issues with wrinkles because they don't have the beard. The beard gives better vascularity to men, and it makes our skin's a little thicker, so harder to make those wrinkles. Now, you can certainly do it if you smoke and you get out in the sun. Men can have their wrinkles, but I'm talking about most of my practices for wrinkles are in the lighter skin types. We don't see this deep wrinkles as much in the darker skin types because we see acne in those people because it's oilier skin, oily, thicker skin. Darker skin is protected from the sun. So what we see in those skin types, Asian Pacific Rim, American Indian, Hispanic, Black, we're seeing more thicker skin, and we see acne in those people if they have a problem more than the fine wrinkles. So what I'm talking about today is typically the lighter skin types, the Caucasian skin type like mine, and typically in women, and we get the deep furrowed lines. A lot of people say it's because I drink with a straw or I smoke. Smoking without question can cause a deeper lines because it decreases the blood supply to the skin and it decreases the oxygen delivery to the skin. We can talk about that on another day. But basically lines can happen primarily in our skin types because we have thin skin that's wrinkled easily. And when we drink and purse our lips and stay out in the sun, we can get these deep etched lines in our skin. We also get some wrinkles under our eyes. We can get it down in our cheek. So laser resurfacing is done with lasers that can that can address those. And so think about it this way. Lasers can either mow the grass, and I mean that'd be like taking off an entire thickness of skin down to a certain level. We can typically go just under halfway through the dermis, through the epidermis and into the dermis safely. And you've seen me hopefully on my website and on Instagram and talking about our preceptorships. Well, people come here from really all over the world to learn my techniques. I wrote about CO2 resurfacing back in the late 90s and wrote one of the definitive papers about that, and then I duplicated that paper in January of 2019 in the biggest journal in plastic surgery about the erbium. Right here behind me, this erbium Jewel X with Cyton is what I use. We only use the best equipment here, and so what it does is it mows the grass. It takes off the top layers. Now, I don't use that around the eyes. I use fractional lasers like aerating the lawn. So if you aerate the lawn, you're not going to make the lawn deeper. You're not going to make it thinner. The deeper you cut the grass, the thinner it is. But if you punch holes in that grass, the grass height is the same, but you'll have holes in it, which allows you to nourish the lawn. But in the skin, it allows it to collapse and tighten and create heat in there that generates new collagen and makes your skin look a lot smoother. And so we use that around the eyes, we use it with acne, and we use it when you have large pores. That's fractional aeration of the lung with the erbium laser. It's called profractional. And so I'll typically do that over the cheeks. I'll do that around the eyelids and over the forehead. And I do it in certain ways so as to attack whatever I want to attack. The setting is shallower and more dense when I want to try to get pigment. It is deeper and less, the deeper you go, the less dense you can be for safety. And so we attack acne in that way. But these deep lines around the mouth, we tend to mow the grass with this erbium laser. And my technique is to go down deep enough to get, there's two endpoints that I look for. A lot of people will come to me because I am the laser guru when it comes to this, and my techniques are highly regarded around the world. And I say that with great gratitude for God who gave me these talents. But it's just what a privilege to be able to treat people, because this is the closest to reconstructive surgery that an aesthetic surgeon can get, in my opinion, because you can do facelifts all day long, but if you have these deep etched lines and the skin doesn't look good, it's not, the facelift doesn't look natural because the skin's 70, the face is 50, and it doesn't match up. So we'll talk about combining that with surgery in a minute. But in general, if you just walk in to my practice and you have those deep etched lines, we're going to talk about doing erbium laser resurfacing to you. And so what that does is that it sees water, it ablates the top layers of skin, and we'll go down, and our endpoint for safety, a lot of people will come and say, I want the results that you published, that you show on your website. Go look at those if you haven't seen those, and I think you'll be wowed. It's an amazing technology that I have the privilege to use, but you've got to know how to use it well, and you've got to know when to stop. Just because you come to see me doesn't mean you'll get a great result. I think it's very unusual for us not to get significant improvement in these wrinkles, but the end point determines when I'm done. If I am treating a patient and I get down and the wrinkle is gone and I can see it, and when it's gone, then it's fantastic if we're still in a safe place. But if I get down, and I did a case today, and if you get down and you get to the point where that wrinkle's not quite gone, but you've got a certain bleeding pattern that lets you know you can't go any deeper. You're in the you're in the mid-reticular dermis. You can't go deeper than the mid-reticular dermis, and it has a certain bleeding pattern. That's what I'm trying to teach the physicians that fly to my office and try to learn this technique. You have got to know when to stop. You can't promise a patient an absolute guarantee on outcome. Many people want that, but it's just not possible. But if we can get to the wrinkle gone, that's great. But the other outcome is getting to the mid-reticular dermis. Now, at that point, if the wrinkle's not gone and I've gone as deep as I can go, I have to stop. Otherwise, you're going to get a burn on your lip and a scar. And so when I stop there, don't be disheartened, because you're still going to get a good result. Usually when I get down to that point, we've still got a significant amount of improvement in the wrinkles. We're either there or almost there. But even if it's not gone, then we're counting on your immune system to come in and put new collagen. There is a response, and you're going to hear about this on the Laser Guru channel a lot, and that is what we're trying to do, whether with BBL Hero, Moxie, Halo, radiofrequency microneedling, other devices, it's to create an area of injury that doesn't kill the collagen, but denatures it. And you've got to get that magic temperature is 55 to 62 degrees. So around every hole that I aerate, at the bottom of every yard that I mow, at the bottom of that, and then take that skin off, and at that mid-reticular level, you've got a layer that's heated to 55 to 62 degrees. And if your immune system puts down a lot of collagen in response, the rest of that wrinkle will be gone totally away. And I've got pictures I can show you about that. And we'll do that here shortly. Not today, but in the future. But if you don't put much collagen, you should still have a decent result, but your wrinkle may not be totally obliterated. And so you just need to know that. But what you want to do is go to a place that has a ton of experience, that shows you a lot of before and afters, and is very confident in what they do, not only You don't need a reckless cowboy. You need somebody that's aggressive enough, but knows when to pull back on the reins instead of go over that cliff with that horse. So that's laser resurfacing in a nutshell, and it's the only thing that I know of that can get rid of those wrinkles. Now, if you have wrinkles left, and there's other ways to do it, you can do radiofrequency microneedling, you can do fractional. That doesn't even come close to getting the result you get with erbium, full field, mowing the grass, laser resurfacing. If you do have a little left, there's some new fillers we can put in those, but the fillers you have to come back and do again and again. It's still a great option if your skin's thin and you can't get rid of all your wrinkles. But the only resolution that is long lasting is erbium laser resurfacing. So I hope that's helped you figure out how we go about doing it. I think before we leave, I'll add one more thing. And most of the patients that walk into my practice really don't want to have me lasering around their face while they're awake, and I have, and there's metal eye shields we have to put in to protect the eyes throughout the entire case. And so most of our cases have a little light general anesthesia that lasts 45 minutes to an hour, and then you're on your way, and it's a very easy way to go about it. Doing it under local is not something that most people tolerate and do very well with, although it's possible in some cases. So that's the only other thing that I wanted to make sure you knew about. The post-op recovery is about, if we go deeply, it's going to be 7 to 10 days to heal that, primarily around the mouth. But where we do fractional resurfacing around the eyes, it's 4 or 5 days to be healed, maybe as long as a week if we're very aggressive. And where we blend it around the face, it's another 4 to 5 days. So 4 to 5 days, maybe 4 to 5 days or a week if we're very aggressive on the eyes, and here about 7 to 10 days around the mouth. Now that means that there's no open wound, no oozing is done happening at that point when I say healed. Redness can go on for 10 to 12 weeks. And people say, oh, that's a big downtime. Well, it is, but I want you to think about something. It usually takes 60 to 70 years to get those kind of wrinkles. You've got to give me 7 to 10 days to heal and 8 to 12 weeks of redness. And you look at the before and afters and you tell me if it's not worth it. Most of my patients, they're the happiest patients I have in aesthetic surgery, because most doctors will tell them, I can't get rid of all those wrinkles. And I can tell you, I may not be able to. But in our practice, we usually get rid of almost all of those wrinkles. Some people, there's still a few that will come in from time to time that don't get the result that I desire, but that's because they don't have an immune system that can put down that new collagen. So I tell people, I just had a lady today say, I'm still out here 21 days and I have intense redness. When I looked at her, she looked great to me. She's pink. That's how I want it, because the sign of putting that new collagen in is construction. And I tell my patients, in Dallas, the sign of construction on the roadway is cement trucks, traffic cones, cement rebar, warning signs, flashing yellow lights. But the sign of construction on your face is redness. The blood vessels dilate to get the building blocks for new collagen in there, and they've got to clean all that up. And so when people say, this is great, my redness has gone away, they may be happy, but I'm not. I want them for a good 2 to 3 months to be red and pink, coverable by makeup for sure, but I want them to be red and pink because that tells me they're putting new collagen in that skin. Those are absolute expectations that they need to have and understand going into this. And so you should be able to put makeup on at about 10 days to 14 days at the most. It'll look like you're having makeup over a sunburn at that point. And then that'll fade away, and by 21 days, any pinkness you have is usually very easily coverable, but without that, you're going to be pink. During that time, that first 2 or 3 months, if you have a glass of wine, you get in a hot tub, you exercise for an hour or so, you're going to be very pink, and your friends are going to go, what's wrong? You tell them, nothing's wrong. I'm just giving all my collagen and my skin a good nourishment. I've just had some treatments on my face. And that's exactly what's happening. So I think that I hope that gives you a little feel of what your expectations are. And if the only way to get rid of those wrinkles that so many women hate is, in my opinion, erbium laser resurfacing. So thanks for watching The Laser Guru. We're here in Dallas, Texas at Resurrect Skin MD in Preston Center, 8226 Douglas. Our phone number is 219-754-6865. Reach out to us and keep watching The Laser Guru. Take care.